All right. Hi, everybody. My name is Cheryl Matthew, and I host this call once a week, every Tuesday at noon Pacific time for Heartfelt Foundation called Navigating Aging. We talk about lots of different topics regarding aging well and becoming our own advocates, et cetera, et cetera. So today's topic is making the most of a doctor's appointment. And so I'll talk a little bit about that, present some information, and we'll have an open floor for sharing and questions and answers or community time. So we'll start with calling in the light, which is a way to bring ourselves together in the oneness of the loving presence that we arrive in. And we'll chant 3 Anna Hughes. Anna is a way to call in compassion and empathy, and Hugh is an ancient name for God. Does anybody want to call us forward into the light today?
I will.
Please.
I'm always happy to. All right. Dear Father, Mother God, we bring ourselves forward into your glorious light and just experience the gratitude that we have for all that is present in our lives, all these beautiful people. And we just trust that that light goes before us, surrounds, fills, protects us at all times, so that only that which is for the highest good is allowed forward. And we ask a special blessing on Cheryl for all that she does for us and for other people in the world to make this road of being human just that much easier, more joyful. And just soak in the gratitude. And light ahead. And so it is. Anna.
Nice. Now I just feel like meditating for an hour.
Right on.
Oh, I need to talk. Okay. Welcome. And so it's interesting, like today's topic, so making the most of a doctor's appointment. I feel my energy, my advocate energy, like kicking up just to address the topic, because when I'm in a doctor's visit, preparing for a doctor's appointment, in the appointment and afterwards, it takes a lot of focus and energy, and my inner advocate kicks in. I really have to like be clear, be thinking, problem solving. So it takes a lot of energy. And what's interesting is when, sometimes we have just maybe a checkup at the doctor and we're feeling fine. And those appointments are generally easy. But many times we go to the doctors, we're not thinking clearly, or we're just not at our best. Maybe we don't feel well, or fatigued or something. And so that's a hard time to do your best at a doctor's appointment. So these are some things that And I think I'll make these into a list and put them on the heartfelt resource page so that people can have them to think about and to like kind of fill out before they go to an appointment, or to have help from a loved one that might be involved in your care or your life. That you can fill these out before, during, after doctor's appointment. So when in those times that you're not feeling quite yourself and need to go to the appointment, you'll have kind of a backup, so you don't have to be the only one thinking about it. That you'll have kind of a format for those things. So there's some things to do before a doctor's appointment, during, and after. And I'll say this format, and when I say doctor, usually that means like a Western medical doctor. This is my experience there. Most of these things are for any doctor appointment. You know, it could be an acupuncturist doctor, or a nutritionalist, or a specialist, things like that. But this is more like the Western approach. So before the appointment, even before you make the appointment, it's ideal to pick, if you have a choice of times to pick the appointment, pick something that a time of day that you feel best. And also, I would suggest to choose a time of day that you will reduce wait times at the doctor. Usually that's first in the morning or first after lunch. So if you call and make the appointment, they're like, hey, when do you want to come in? And you could tell them either first in the morning or first after lunch, because sometimes the doctors gets backed up during the day. Okay, so what do you want to bring to the doctor? And I would say it's best to have these in writing, not just in your memory, because right now you might be able to go, okay, well, I know my medical history and I know my current medications and symptoms in my mind. But when we get to the doctor sometimes, and we know, like, I have 10 minutes, maybe 15 minutes with the doctor, and it feels rushed, and they're talking and you're talking, and it just gets kind of chaotic. So it's good to keep, I would suggest writing these things down. First, your medical history. And they will often have you fill out a piece of paper or an iPad with this information. And usually I find that the doctors don't really even look at that information that you fill out. I'm not sure why they have you fill it out, except for, I don't really know. Actually, it was like legal reasons, I'm not sure. But just because you fill it out, like if you're a new client, new patient, and they'll have you fill out your medical history and your family history, things like that. Oftentimes the doctor won't see that before your appointment. So don't expect that they'll see it. But you have written down your family history of important things that relate to your diagnosis. So family history, past surgeries, any allergies. So some basic information about yourself. Secondly, your current medicines, your current medications, including when you started, how long have you been taking them, what do you take them for, and any recent changes. Most of the time, I find our healthcare system now works on, it's a disease model, or it's not a prevention or preventative model, like, hey, I'm feeling great, I'm going in to see if there's anything else I can do to improve my health. Most of the time people go to the doctor, it's, I've got this symptom going on and I need your help to solve this problem. I've got shortness of breath, I feel nauseated, I'm losing weight, I've got a sore something, my joints hurt, whatever it is. So it's something is driving you to make the appointment. So you want to write down any of your current symptoms. Why are you there today? Why are you there? Why are you going to the doctor? So the idea is that you want to bring any pieces of the puzzle that you know of, so that you can help the doctor put the puzzle together. So you know what's been going on for you, And the doctor has experience and education to put the pieces together. So you want to bring the doctor any pieces that will help them solve this puzzle. So symptoms like, and also when did the symptoms start? What have you tried to do that has helped or not worked? Are there any triggers? Anything that you think is correlated to the symptoms? Like anytime I drink milk, I get this rash. So that takes self-awareness and paying attention. And it also helps to keep a health journal that you can write things down. Sometimes I'll go, oh, I had this rash on one side of my chest recently. And then I go, oh, I've had this for like a month and it won't go away. But then if I look back at my notes, I'm like, actually, it's been like 3 months. And so time flies by. So if I write things down, it really helps. And anytime something happens and I go, oh, I don't need to write that down, I'll remember. I just go, no, Cheryl, you need to write it down because you probably won't remember. So symptoms like weight loss, rash, confusion, changes in bowel habits, nausea, bleeding, personality, fatigue, dizziness. How's your sleep pattern? How's your eating? Anything that is going on around why you're at the doctor that day. So also you can bring any kind of tests that you've already had. Have you had blood work, any x-rays, MRIs, anything that will help? Also, around the symptoms, you could write like anything that you know of that triggered the event. Oh, I lifted this really heavy weight and my shoulder started hurting. That was like an exact time. I heard this pop and that happened. Or maybe it's just like, it just got slower. It got worse over time. So all those kind of things change the diagnosis and help the doctor understand what might be going on for you. Also, write down any allergies that you may have or sensitivities. Anything you've done differently, like, hey, I went swimming in this lake the other day, and ever since then I felt this. Or I went swimming in the ocean right after that rainstorm. Any exposure to toxins, chemicals. Okay, and so then you want to prepare your questions. So you want to write them down. Again, at the doctor's appointment, it may feel stressful and they'll start talking and it may be confusing. So take notes at the doctor's appointment. And if you have a trusted friend or advocate that can go with you or even be on the phone with you during the visit, that will help. Like someone who already knows the situation and that could either write down, maybe they're just there for moral support and to write things down, or maybe they are used to being an advocate for healthcare and they can ask questions of the doctor. But two brains is often better than one with anything medical. So that will help. Okay, and so then what do you expect from the doctor? So most of the time, the Western medical doctors have just a couple or a few tools in their toolbox. One is they're going to give you medicine. Two, they're going to give you a referral to a specialist or a referral for blood work or some kind of x-ray. They may ask you basic questions as far as other things that might be involved. Most of the time, you're not going to get questions from them as far as what's your diet like? Sometimes they will. Are you exercising? Are you moving? Things like that, that more of a alternative healthcare professional will ask. And it's funny to say like that's alternative, but what you're looking for is a doctor that looks at the whole person, that could not just look at a symptom and, give medicine or surgery for that thing, but that looks at your whole person. And oftentimes you are going to have to be your advocate for that part. Like if you think nutrition, sleep, supplements, vitamins, things like that. Often the regular medical doctors don't have a lot of training in that area. So I don't expect them to make suggestions with that. But so that is another aspect of being your own advocate that sometimes outside of a regular medical doctor appointment. So they're going to give you these suggestions. Hey, go see this rheumatologist, go get this test. And then what you also want to write down is when you can expect the results from those tests and how to follow up. I find that many times I won't hear from the doctor's office. Like I'll go get some blood work done or an x-ray, and a week later I haven't heard from the doctor's office at all. And so I'll need to call them to say, hey, what do the results look like? And if you think, our physicians right now have lots of appointments, they're very busy, and they've got lots of patients to follow up on. So I just assume they're not going to remember me. So I'm not waiting to hear back from them. I'm being proactive and being my own advocate as far as following up. And sometimes I'll even have them email me the results so I can look at them, or sometimes I have other healthcare practitioners, a chiropractor or an acupuncturist or a nutritionist that can look at the results as well. So you want to follow up. And then after the doctor's appointment, you want to review your notes. Look at the notes you just wrote during this concentrated visit, usually. See if they make sense. If you had a person there with you, check your notes, talk about it, see if you remember the same thing. And then follow up on the items that they suggested. If you need to go get a test, go get the test, and then follow up with the doctor's office to see what the results were, and then next steps. So hopefully the doctor will talk about a treatment plan as far as go do this test, follow up with me here, do this plan. So you have some steps in place. And then just keep your health journal going as far as I tried this, I did this test on this date, these are the results. And so you have everything tracked. I find that still all along that you still will need to be your own advocate, right? You're still thinking about it. You're the one in charge. Like after you leave that doctor's appointment, most of the time that doctor's not really thinking about you. So you've got to be the one to follow up and to try things that they suggest, or if they don't feel right, I think that's the other thing I would like to say. Like, you don't, just because your doctor says to do something, it's still your choice. Sometimes there's medications that, are known to go like, this medication may not be what we need today, or this may have other side effects. Do I have to take it? Well, you don't have to take it. It's always your choice, and you could look at the pros and cons, and so you're the driver of your own health. Those are the outline. That is what I wanted to convey to you as far as the outline. I'm interested in your sharing, in your questions. This process takes energy. And it's training you to be your own advocate, your own self-care advocate. And the more physician's appointments I accompany people to, the more over the years it's like, wow, I really have to be my own advocate. I just can't go like, oh, I'm going to go to the doctor and they're just going to solve everything for me. They, in addition to, I really need to I have the opportunity to make really healthy choices, like those things that I don't really want to do, but I do want to do because I see the effects on people, right? It's easier to just eat junk food and sugar, and I don't know, smoke if I was smoking or something, like do those things are sort of easier. But the like managing all these health appointments, if they're based on my poor choices, like the consequences of them are considerable. So after being with people as a geriatric care manager for so many years, accompanying people to these appointments, I really see that it. Jerry used to say, well, people will change when they're sick and tired of being sick and tired. So that's often when, I think probably most people change. Like, I'm going to do this thing until I just, I'm sick and tired of it. And so if we can be sick and tired like earlier, so we don't get really sick and have to go down that route, that would be ideal. And then we do what we do. I hear many people talk about, well, I have cancer, and so now I'm doing these other things. I'm fasting, and I'm doing green juice, I'm doing acupuncture, and I'm getting healthier. So then I always ask myself, like, well, why don't people just do that now and then try to avoid that later? But people do what we do. It's just a for me, a reminder that I have the choice to make healthy choices today, to try to avoid physicians appointments later. Yeah, I think that would be my message. So I'd love to open it up to you all. What do you want to talk about? Hey, Don.
I would add that when I go to the doctor and my blood pressure is being monitored, I would have very little success if I didn't remember to write down, or at least memorize, preferably write down my blood pressure for a couple of weeks. You go to the doctor and the blood pressure maybe it's going to be sky high because of the white coat syndrome. The standard is you're supposed to sit down for 5 minutes, quiet before they take it. Now they take you in the waiting room, running, sit down and take it. So it's going to be, et cetera. But anyway, and the doctor had really good success. They pay attention when I come with my own readings, and anything else that I can. First, I am a doctor, a chiropractor, and when I look at the X-rays and MRIs and stuff, I can look at my own, and I can lead. I mean, the doctor looks at the MRI report, and 2/3 of the time he doesn't really get to the point, which is there's what's really critical and important in this case. Because things are very technical. So anyway, anything that I have the background on, and or like I have no memory as to if I had that rash, if I had it 3 months or 6 months, if I'll remember, but just a few things. And if I have a cooperative doc, I hand him in very big, careful print, but maybe 3 things that I really want to make sure that I get across. And so I've got my copy, and I got some from him. And if my list of meds, I've got a copy, or through the copy machine. He's got hit. Usually before I see my doc, and it's so much mechanized in a sense, first will come and describe the assistant or someone, and they'll go through the computer if I'm lucky, and they'll input this stuff. They're real good about it. I hand them written stuff. They'll just type it right in, and we'll go through all the time consuming things of like, how do you spell that medicine? I don't know. Look at the list, and that's my big contribution. What I bring with me. When I go with someone else, boy, I do so much better job than I do on my own.
Right.
But then at the same time, when I leave the doc, and I think I go to doctors about 2/3, not for their expertise, not to order something, but I really listen when a doctor or a nurse or a good healthcare person talks to me. I mean, I could be a 3-year-old, my dad's, or a 6-year-old, 12-year-old, my dad's talking to me, or mom or something. I take it to heart. It's motivating. But I leave that office, and I may be motivated, but I don't remember what I'm motivated for. The next day it's all whoop. So, as you say, what's written, and if I'm the advocate, I want to remind that person later. You know, those of us that have some memory problems, and if it's myself, I got to look at half the time I lose my notes, but I need to, like when I'm helping someone else, I got a folder, a duotang. This is this, that's theirs. We take that, we leave it, we write it in. It's a color, or it's got a picture of a tiger on it or something. And it's something really memorable. That's what I got to say.
Those are great ideas. Thank you, Don. Yeah. Yes, the doctors are busy, and they usually do really want to help. So I just try to make it as easy for them as possible, right? So I have things in writing. It's a great idea to just, give them a copy, bullet points. These are the main things, and so they can really start being creative instead of like wading through, having to draw questions out of you, like, how did it start? Okay, this, and when did it, like, you've already thought, what, you've been to doctor's appointments before, the kind of questions they're going to ask. So you've got the answers already for them. And yes, that's it. And to have a folder, write things down. And what's interesting to me is sometimes they'll just, almost always, the doctor will start rattling things off. Okay, I want you to do this, 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 this. And that information will, they most often, they won't even write it down anywhere. So every so often, their computer program will spit out something like, hey, this is an aftercare plan, and follow up with these things. But it's still just information on paper that doesn't quite make it in, especially to the patient who's not really thinking clearly. They're having trouble, and that's why they're going to the doctor. So having things in writing, giving to the doctor, writing down, steps of what am I supposed to do, when am I supposed to do it, how to follow up. Yeah, those are great things. Thank you, Don.
And always for me, as I'm leaving, the staff is saying, "Oh yeah, we've got an appointment for you. It's the 23rd of. Is that okay?" I'm going to check with my little calendar and things, and I ask them, even though I may be putting it electronically in my device or something, ask them, give me the card with the appointment. Give me, you write it down. It's amazing how many times what I entered on my calculator does not match the card. Mm-hmm. Anyway, well, that's that. And that in the importance of that folder, that's memorable. If you got memory problems like me and confusion and things around, it's I know with my wife that she was becoming more and more out of it, and I'm getting more and more tired trying. The fact that I could grab this duotang that had a particular picture, she doesn't know it too. It has the picture of the tiger or whatever it is.
Yeah, it's a great idea.
Such a saving. Where's the medical record? Oh, not the big medical records, the file box, but the stuff we're really dealing with. Thank you.
Yeah. All right. Thank you. Dore.
Hi, thank you. I have an example today. I'm really going through a lot of challenges. Had to move, lost my house, West Palm Beach, and I moved 4 hours north where I was. I don't know anybody here. I have no emergency contact. It's really pretty scary place to be. The people around me, neighbors, kind of keep to themselves, even though I reached out to introduce myself. But anyway, aside from that, I've gotten myself really I finally, after a couple of months, got an appointment with like therapy online. But what happened was, the intake showed that I was at like, oh my God, on the scale, of anxiety level and depression level, I'm like maxed out on that. I'm really at the end of, the highest level that they could imagine, that they have, that they determine. And it's caused me to, you know, really isolate myself a lot. And then I got really frightened about, my pets, what's going to happen if anything happens to me. So I, I, like I said, and then after the session today and finding out the intake results that were performed online, it's pretty serious. And then they scheduled me, they suggested that I go on medication for anxiety and depression because I'm really at a pretty critical state with it. And then I get this text saying they scheduled an appointment for me 3 weeks from now. And
Mhm.
I'm thinking, if I keep going at this level, for 3 more weeks, God only knows what's going to happen. Do you know what I'm saying?
Yes. Mhm.
So I texted them back saying my levels were critically high on both anxiety and depression. And I don't think that it's beneficial for me to wait 3 weeks for a consultation, regarding medications. And so I'm waiting to hear back. But at the same time, I don't want to take medications. But at the same time, it seems like, you know, it's like I've been relying on the grace of God, to pull me through this, which means staying in bed, doing my SEs, lengthy periods of time, meditating, praying. But at the same time, when I get up out of that state of peace, then all the realities of what's going on around me and how things are falling apart, and all my attempts to get help over the past year of being here and watching things fall apart in my house in disrepair and not financially having the money to repair things, getting electric shut off, phone shut off, TV shut off, I mean, I'm really living on it's a pretty scary place to be. And I mean, I worked in the elder care field and was a strong advocate for a lot of people, and it seemingly is right now. I'm not a real strong advocate for myself, and I don't have anyone, even though I've reached out to my health insurance. They keep dragging things along for like a year later, you
Mhm.
know. So, um, I mean, I just, I have to be my own better advocate because the agencies I reach out to don't help.
Mhm.
And
Yeah,
like
that is.
it's pretty scary. And I've even told
Mhm.
the case manager with my health
Mhm.
insurance, I said, it seems
Mhm.
like at the rate things are going, and I could die here and nobody would know.
Mhm.
And then
Yeah.
her response was, well, maybe you should go into assisted living. I'm like, I don't want to go into assisted living. If I could
Mhm.
get help here, then I don't have to. I don't want to, you
Yeah.
know? So it all comes back to what's easiest for them rather than what's most beneficial for me. And working through the red
Yeah.
tape of the system is really grueling. And especially it triggers the anxiety and the depression level where I just feel hopeless, you
Yeah.
know,
Yeah.
and I really don't want to continue like this. and I don't know where else to reach out to.
Mhm. Okay. All right.
So,
Thanks for bringing that to us. Appreciate
yeah.
that.
All right. God
So,
bless us all.
oh, God bless
Live
you.
all.
God bless you. Well, you bring up an important point as far as the timing, like our medical system sometimes is super slow. Maybe if we've got something going on, we go, hey, I need to go to the doctor. And then we call the doctor and it's like, all right, well, we can get you in an appointment in 3 weeks. Okay, then you show up to the appointment in 3 weeks and they say, okay, I want you to go get these tests and then follow up with us in 3 weeks. And so then you go get those tests, you follow up in 3 weeks. So that's already 6 weeks. So you're even thinking about an answer. And so everything gets drug out like that. So what I do, so that's just a reality of our system. What I have learned to do is if it's critical, like if you're saying like, look, I am so depressed that this is not working. I'm so anxious that this is critical. I will either go to an urgent care, bring someone to urgent care and get the test, or go right to a hospital. So I've done this a couple times in the last few years with people that have situations going on that need to be handled. They're not critical. They're not necessarily life-threatening. Of course, you go to a hospital for that. But if I need an answer and I know it's going to take a while, I had this one patient, for example, they were having some blood sugar issues. They couldn't, they weren't diabetic, but they were having some issues with their blood sugar such that when they ate things, their blood sugar would drop instead of raise. So they, and it was going to take about 6 months to get an appointment with an endocrinologist. Well, that was like way too long for this because they were experiencing dizziness, fatigue. It was affecting their life. So they couldn't really manage. So the next time that person experienced that, the symptoms said, let's go to the hospital. So when we arrived, they were in that state. And so then I asked them, I had researched it already. So I knew what that might have been called. Like for that person, it was reactive hypoglycemia. Like, so I'm thinking like, hey, this might be this. And then I knew what test to ask for, or to, just from doing some research. So we're in the emergency room, and I was able to give the people the symptoms. It was going on now. I asked them what test to run. The doctor there also had suggestions, but then the doctor there had had a endocrinologist on call. So that emergency room physician called that endocrinologist on the phone and gave them information as far as what test they should run right there. So they ran the test at the hospital, had some suggestions right away. So we didn't have to get checked into the hospital. We could go home, but we had all this battery of tests run at the hospital. And then the endocrinologist said, because now you are connected with me, I'm going to make you an appointment in like 2 weeks. So we were able to get the appointment, we get the test, got the appointment, and we're off to the races really quickly. So just doing that, I probably cut down on 2 or 3 months worth of back and forth to test and back and test and back. So, it's not my preference to go to the hospital, but that's the way our healthcare system here in the United States is set up right now. So I was using the system that we have in order to get this person help right away. So sometimes we need to do that, and especially if it's something that's affecting your life such that you can't really manage your work or your life, so that you're feeling safe. So sometimes the having, just cutting to the chase, going to the hospital where you could have the battery of tests run. Second example, same vein. A friend of mine was at a wedding. It was held in like this park, and she had to go to the bathroom. She had high heels on. They said, "Oh, to go to the restroom, you got to climb down this hill, which is just some steps with rocks, and it was really uneven." She goes down the steps with her heels, slips, fell, falls all the way down the steps, smashes her face, hurts her knee on one side, hurts her ankle on the other side. It's just a mess. So the paramedics take her to the hospital down there, and she's like, "Okay, I'm fine. I don't have any life threatening," and she lives alone. But she's just going to go home. So her family like got her into the house at home, but she couldn't even walk. And so at the hospital, they say, "Okay, so go follow up with your orthopedic surgeon, see if you need anything with your knee. Go to this person and follow up with your nose to see if that is broken. Go to this person for your ankle." Like, but she couldn't even walk, and she couldn't drive. So none of that made sense. And that was going to take, I don't know, 6 months of appointments, and she would need to hire help to do all that. So I suggested just go back. She left the hospital because she was like, "I don't want to, be here." And she was a couple hours away from home. So I suggested, look, just go back to the hospital and, tell them what's going on. So she went back, they checked her in, and she ended up being there for probably a week, but she got all the appointments, and she was able to be there and be cared for because she couldn't care for herself at home. So it's an example of sometimes we need to use our hospital system to get the help we need, and depending on the situation. And yes, there are hopefully in our healthcare, the insurance system, sometimes they assign a care manager who can help. And what really helps is to have an advocate who's used to managing the system, the healthcare system, and who is thinking clearly that they're not the one in need of help. In your insurance company, it could be a care manager. There's also professional care managers like myself, but there's a national organization called Aging Life Care. So aginglifecare.org has care managers around the country. You can type in your zip code to find one closest to you, and they can help manage, help you manage the healthcare and give the services you need. So I hope that helps. And we're sending lots of light to you. Karen.
Okay, so I am typically the person who accompanies my mom to medical appointments, but I don't live with her. So keeping a healthcare journal about her is challenging because the way she reports information to me is often, well, let's just say it has holes, and it's flavored with what she wants me to know or think. And then we get to the doctor and they'll ask her questions and she'll say things that don't seem accurate to me, or she won't report things that I've noticed, but she doesn't want to talk about. So I'm wondering if you have any suggestions about how to, I mean, look, I'm totally getting that she's going to do it her way in every way. But when I'm her trusted person in the medical person's office and I'm taking notes and I'm writing things down, then I come home and I think I have an expectation that she's going to actually do the things that they've asked her to do. And then when she doesn't do that, it leaves me feeling frustrated. And anyway, so if you have any suggestions about how to navigate all of that, maybe it's just an inner job for me because I can't control her. But I do want to be a good trusted friend in the medical office. And I'm also recognizing as I'm saying all of this, that I don't want to be like that when it's me that needs the help. And, I think humans do what we do. So maybe I need to just take note for myself. Anyway, what you got?
Well, that's a great question. And I just want to say, it's just it's completely normal. It's so funny that so many people will have something going on at home. uh, what's an example? I have shortness of breath, and like people around that person will be like, are you okay? You sound a little winded. Oh no, I'm doing fine. I'm fine. I'm fine. And then finally, maybe they'll make a doctor's appointment, and they'll go to the doctor, and they'll be like, hey, how are you doing? Do you have shortness of breath? And they'll be like, not really. Maybe just a little bit, but it doesn't bother me. Like they super minimize it. So where at home, the symptom might have been like a 10 out of 10, and they get to the doctors and they're like, it's a 1 out of 10. And especially if you're, say, an adult child, or, whatever that role would be, like I'm taking my mom to the doctor, and at home, she's like, oh, you can hear her wheezing and doing these things. But then they get to the doctor and she's fine. And it can feel so frustrating, because like sometimes it feels like I'm working harder than she is, or she doesn't want to get better, or she's lying, or she's like all these feelings come up about what they're doing. So when I realized like this is just like a normal human behavior, maybe protective, maybe some denial, and especially I think that I'll say I find it. I think people, like younger people, may be changing their relationship with their physician, but in the maybe 75 and older, 80 and older, something like that, at least, like those are the folks I would normally help the most. More typically, there's a relationship with their doctor that puts them more on a pedestal, the doctor on a pedestal. And so the patient, say my mom in this example, has like, well, maybe they may have not even, they're at home feeling horrible for weeks, and they're like, okay, it's time for the doctor's appointment. And at home, they hadn't even gotten out of their pajamas for weeks. They can't even get out of bed. But all of a sudden, it's a doctor's appointment, and they're dressing up. They take a shower, they put on makeup, and bam, show up to the doctor, and they're looking good. They're like, wow, what's this about? All of a sudden, you have energy for this. And then it's like, maybe like you didn't even have energy to have dinner with me the other night, but all of a sudden you're dressing up for the doctor. So there's all kind of feelings that go along with that. But I've just seen it so many times now. I just say, well, it's just normal. So I'll say that part of it is most doctors are used to people doing that. So they're used to when they think, okay, the person that's showing up in my office, this is the best they can do. This is the best they've got right now. They pulled it together, and this is what they've got. And so they kind of judge everything in accordance to that. But if that person has had a long history with their doctor, sometimes the doctor really kind of buys their story. Like, oh, your mom is fine. I don't know what you're talking about. You're like, oh, you should see her at home. So there's both things can happen. So it does help if you're really concerned about someone and you're going to the doctor's appointment with them, for example, to write down your concerns, what you've seen, and be specific. And this is when it started, this is when it stops, this is what they're doing. And you can give it to the front desk. So you say, hey, can you just make sure the doctor has this for our visit? And just say like, hey, it's between you and me. So they'll have their chart. And so they can ask the person, like they can ask my mom questions without me having to go, what you want to avoid is that you're not overcorrecting your person or your mom during the doctor's appointment, because then she doesn't feel great, because she's a proud woman. I'm doing fine. And then you don't want the appointment to look like, mom, that's not really happening, mom. So the doctor has this list and they know what's going on, then they can compare it to what your mom is saying. And so the doctor can take all of that into consideration, knowing that she's showing up the best that she can do. And I find that you can just do all that you can do, but it does help knowing this happens so that you'll be less surprised during the visit. Because sometimes that's when it will happen. Like, if it takes you by surprise and then you're like, what? You just know that's what people do. And then what's true is people will do what they do for as long as they possibly can do it. They'll do it their way. So say your mom is struggling, maybe she's having shortness of for example, and maybe she's not being completely truthful with the doctor. Well, she's going to be the one to have the consequences of her choices. I guess she's not saying, look, doc, I can't breathe. Can you help me? And she's saying, well, it's not so bad, then she may not get the answers to her problems, so that she just has shortness of breath. And then she deals with that until she can't anymore. And that'll become clear.
Okay, but then there's the other piece, which is, yes, she will live with the consequences, but so will I. And setting boundaries with my mother, who may be incapacitated because of her choices. And then do I just go, well, you created that, so that's on you? Like, so I do feel like I have a vested interest in her choices, because her choices also impact my life. But I appreciate the information, and you're right. I won't be blindsided. I do have an appointment with her tomorrow, so I don't know how to slip the doctor a note without her knowing about it, but I'm going to think about that. Thanks for the info.
Right. That's a good point. And then sometimes now on medical records, like the patient can see things. So you got to just, yeah. And, the truth is that so she's bringing you to her doctor's appointment. So you're her trusted person, right? So, now what I was going to say just flew out of my mind. So she has, as long as she has capacity, meaning cognitively, she has capacity. She can manage her own life. She doesn't have dementia or some kind of cognitive impairment. She has a right to make her own decisions, even if they look like bad choices to you and me. Even if we think, wow, if you just did it my way, your life could be easier. Or if you did it my way, my life would be easier, right? There's all these things. So if you show up in loving and you go, I will be here, and even ask her, what you want me to bring you to the doctor? You want me to bring you to the doctor? Do you just need a ride? Do you want me to be there with you? How can I support you in this situation? And just do that. If you giving someone the dignity of their process and their karma and their life and their choices is, I think, the biggest gift you can give them. You can always offer their choices. And I would imagine that you've given her really good ideas before in the past, over and over again. And then she keeps doing it her way. She might take something to heart or do something different, but she's going to do it her way. And so just allowing her to do that can be the hardest thing, but it's the greatest gift that you can give her, because maybe she's got to just do it that way to clear this last karma in this life. Like maybe she needs to do it that way because that's the best for her. And then can you just love her anyway, no matter what she's doing? I would imagine, like as a kid, you might have done some things that she didn't want. And then, inside you might have been asking her, can you just love me with these choices that I'm making? Can you just love me? Because I got to go do this thing, even though it may not seem like a good idea to skip school today, but I want to do it. Can you just love me anyway? It'd be kind of cool. And you'll know when it will become very clear when it's your time to help. It will present itself. Thanks, Karen. Hey, Nancy.
Hey, everybody. Good answer, Cheryl. That was good, if
Well,
I
thank
may
you,
say
Nancy.
so. Well, you're
I
welcome.
appreciate it.
So I just have a couple things, because I'm in this situation of seeing a couple different doctors who have ideas about medications and timing of medications and so forth. And to your point in your introduction, it's my understanding that most doctors are not trained to be to treat the whole person. They're trained to treat their specialty, if they can identify it and so forth. And then, so I have among other people, a cardiologist who several months ago, I changed doctors so that I'm seeing this cardiologist. And several months ago, it's in some of our first meetings, he recommended a medication that's new on the market. And my immediate physical response was that it felt bad to take this medication because my body really reacted to it. And I was smart enough to observe my body's response and to be able to tell him what that was. And he was smart enough to listen. And he and I worked out a system of figuring out scientifically what would work the best. And I'm very grateful for that. But in all of that, one thing I learned was, because I have a caregiver who goes with me and takes notes and so forth. But it helps to have everything written down also, because we're at the doctor's house or office, and it's the doctor who is God in this case, and he speaks in a language that I don't fully understand. And so he says, take this, and I might as well say, okay, and take that. And I've learned that all of that is, none of that works. I need to take him in as a partner and take myself as a partner and write down what I want to write down and share with him. And then he pays attention and is very helpful. So writing things down before you go into the doctor's office is definitely a must, it seems to me. And also that takes observation. So I have a whole new job here of watching what my body's doing with any given change, and making notes about that so that I can report honestly what's going on. So that's it for me for now.
Yeah. Well, thank you. And you've been so wise with your health, Nance, and getting support and knowing like, hey, I need somebody else to come with me and write things down and help out with that. And yeah, it's a great key, observation of self. And then can we be open to others' observations of us? I want the people around me to bring me their observations, because I will have blind spots. I'll have things that I don't see or can't see, that if other people tell it to me, I will be really grateful. And it's funny how often we kind of keep those things to ourselves. Like, hey, you've been limping a little bit lately, or you're slurring your words just a little bit. Are you feeling okay? So those kind of things can really help, because noticing before they turn into something big or turn into a fall or something like that are I think really helpful. Not everybody wants to hear them. So it's a matter of being open and telling the people around you, like, yeah, bring me I want to know what's what's happening. I am so used to, because I've been, doing this for over 20 years and have always been very physical and athletic. So I notice things in people's bodies. I notice how they walk, or if they're limping, or I see their eyes and what that could mean. And then doing care management for over 20 years, my job was to observe. So I might go to a client's house and it may just look like I just went over to visit, but I'm not just visiting. I'm looking, I'm observing, I'm noticing everything. How is their table more messier than usual? or what's different about this? You know, they used to keep their tools all put away after they worked, and now they're leaving them out. That's interesting. Tells me maybe they don't have as much energy as usual. So all these like red flags stick with me, and so it's noticing ourselves and our loved ones, and then when to say something about that. Is the person that you're saying it going to be open? It could be a question, sort of like what we talked about earlier. Hey, if it could be a general question too, like if I notice things about, I don't know, your health, something like that, would you want to know? The person will probably tell you. Or I noticed this, are you feeling okay? And for me, if someone told me that, I would be so grateful because they cared enough to share that with me, right? So it's helping ourselves, helping each other, observing, keeping track, writing it down. Any last comments? Thank you, B. So nice to see you. Thanks for your love. All right, that was a lot of information, fabulous information. That could be like, that's like 20 years of experience and plus everything everybody shared, like lots of great information to help during important times when we're trying to solve things that are going on so that we can feel better, or a loved one can feel better. How can we be advocates for ourselves and advocates for our loved ones in our healthcare system today? So I love you. God bless you. Thanks so much for joining us.
Thank you,
And
Cheryl.
hope to see you again. Thank you.
Thanks, Cheryl.
Yeah, thank you all.
Thank you.
Thanks. Take care.
Bless